Hey guys, it's Dr. Greer. I'm going to be joined in a minute by Dr. Gallus, and we're going to be doing another episode of Carpools and Cannulas. We didn't do one, gosh, was it only last weekend? 2 weeks ago, because we were both at ASPS. Okay, you cannot sit next to me if you're going to stick your tongue out, little miss. But you can be next to me. Dude, move. Oh, come sit. Just don't stick your tongue out, please. All right, so the kids are here with me, and the dog is also here with me. And we're waiting for Dr. Gallus, who I think maybe is on the wrong account. We'll see. We're going to talk about arm lift tonight, which is a fun topic and something that I love doing. And I see Aaron's here. Hi, Aaron. I feel like I know you. We get to see you so often this way. All right. I keep accepting Dr. Gallus's request to join, but it keeps disappearing. So I don't know if it's that account. We'll figure it out.
Why does she not like you?
Wyatt asked if it was because she doesn't like me. No, I think it's just because she's having technical problems with Instagram.
Wait, did she ask you?
Yeah, she asked to join and then it wouldn't let me. There we go.
Okay, there you go.
Now we can go live.
Wait. Oh, that was not live?
Maybe.
Hey.
There we go. Oh my gosh, I kept hitting accept and nothing happened.
Oh, that's weird because it was requesting and then I was like, maybe it's the wrong account or whatever. I switched it up. It just requested, went into, anyway, hello.
Yes. Hello. Yeah, my son was like, what, does she not like you?
I heard
She's not
that.
accepting
I'm
your
like,
request.
No, I'm here. No,
Yeah.
She's just old and she doesn't know what this Instagram stuff is.
We can both be old together. It's fine.
So I have a guest.
Yay. Oh!
This
Hi.
is
I'm so happy guest. What's your
yeah.
puppy's name?
Well, this isn't my puppy. This is my sister's.
Oh.
I have a puppy. She runs around. She'll make an appearance at some point. But I'm also watching my sister's dog, Surrey. This is Surrey.
Oh, fun. Hi, Surrey. Lincoln says hi. I'm like, come here.
Lincoln.
Yeah, Lincoln. We adopted him. Honey, I'm like surrounded tonight. We adopted him actually right during the shutdown in 2020. We lost our dog and we adopted him, and he's
nice,
pretty fun.
Hi. Erin has 4 dogs, so she's a dog fan.
That's a lot of
Dogs.
That's fun though. I like
Full-time
dogs.
dog. Yeah.
Yeah.
All right. So I have my
He's
service
so
animal here.
cute. He's such a good
Nice.
Just sit. Or my dog would be running around. So it was cool to see you in Atlanta.
I know. We got to meet in person. You're exactly as tall as I imagined, which is funny because usually you figure people are like way taller or way shorter.
Yeah. Yep. Yeah, it was pretty cool.
Mom.
And I was just telling somebody that, and they're like, "Wait, you guys don't know each other? You way back?" I'm like, "Well, we do, but not
We
really."
kind of. I mean, we know each other from like Zoom meetings and committee meetings and stuff.
That's right. That is right. So it was really neat. I wish there was more time. I felt like I ran around the entire time. It was from one thing to another.
It was busy, and like the more meetings you go to. Although I did love having the talks recorded this year. I was able to go back and watch them that were at the same time as other things. Or, if I just didn't feel like walking the 1.5 miles to the convention center. It's a long walk.
It was a haul. I feel it gave me Vegas vibes where you're like, oh, it's right attached to the hotel. And then 2 miles later, you're like, oh, okay, we're at the room I need to be.
Yeah.
So, so it was good. Next year it's in Boston. So even farther for me.
I've never been to Boston.
I went the last time the ASPS meeting was there, and I can't say I saw much of Boston. I pretty much spent the entire time in the hotel and convention center, similar to Atlanta.
Yeah. Well, it's like you're so busy. Yeah, I got out for a brunch. There was a brunch like somewhere not close by, and that was as much of Atlanta as I saw.
I went to dinner at a place right next to where the brunch. the first night I was there, which turned out really nice. But yeah,
Oh, good.
it was the garden room or something, right?
Yeah, the garden room. Lots of flowers, lots of like fancy food. I had a lobster omelet. It was pretty good.
Oh, wow, that is fancy.
Yeah, and then they had like fancy chicken and waffles. I have little hands wave.
Wait, can she hear me?
Yeah, they can hear you
Yes.
if you're loud. And they can, she said yes, she can hear you. And then here's the other one. And then the littlest one is in bed.
Oh, that's
Okay, guys.
How's that going?
Well, okay. I mean, the baby just gets up really early now. I say baby, she's 2.
Yeah.
But
like,
yeah, not too bad. I mean, I can always go to bed really early, so we all just go to bed at like 9 now, and that's fine.
oh, that's good. Yeah, I keep waking up early. I'm the worst with time. But anyway, well, we were going to talk about the arms race, right?
Yes. Yes.
We're all about arms. I was trying to come up with cliches for arms.
Arms race is good. That's
open
nice. Well, then you can have the whole soundtrack by Journey.
Yeah.
I should put that on my playlist, and then when I do brachioplasties, we can tee it up. There's already a lot of Journey on my playlist.
Oh, really? That's funny.
Yeah, we have like the most eclectic playlist. It's got like Usher, Boys to Men. There's like Eric Church, and then we hop into like State. Yeah, it's a good list.
What about my playlist?
Yes, you have a good playlist too. I'm talking about my work playlist, guys.
So okay, well, so
Let's see.
how do you? Let's start with the big guns, literally the brachioplasty.
Oh my gosh. Okay, guys, I'm gonna move to a chair because I'm literally being climbed on. There we go. Okay.
So your brachioplasties, what technique do you like to use? Do you use the avulsion? Or
Yes, I do. I switched to that,
Mhm.
gosh, a couple of years back, and then started doing it for thigh lifts as well. I actually have a video of this, which I need to share on Instagram, but I need to talk to the patient first. It's just such a cool technique. Is that what you do too?
Yeah, same thing. I switched also a couple of years ago, and I really like it because from the patient perspective, it's the same result. I think it limits any injury from the cautery, you know, so we're like nerves or lymphatics, because you're not excising all that tissue, you're clearing out the space. And then I don't put drains in either when I do it that way, which is
I don't either.
lovely for
I mean, who loves drains? And just to explain to you guys what the avulsion technique is, avulse means to tear something off. It's a medical term. And with the standard brachioplasty, we would make the skin incision and then dissect all that tissue off with electrocautery. And it's a little tricky to stay in the right plane when you're moving around a curve. And it also takes a little while. So with the avulsion technique, which I can't remember who coined the term. Hunstead. It was Hunstead. Okay, yeah, because we used his blunt cannulas for infusing tumescent. So it's the Hunstead avulsion technique, and what you do is you really aggressively liposuction the area that you're going to excise, and that does all the dissection for you. So when you make the skin incision, you literally just pull the skin off, which sounds awful, and it looks really graphic if you watch a video of it, but it makes for a beautiful dissection. It leaves all those little sensory nerves intact, and it doesn't damage the blood vessels. It's a really nice, elegant way to actually do the surgery.
Erin's noticing that I have a guest.
I know.
She's so good and calm. My sister's
That's
on a
nice.
plane. I was like, you're going to miss your dog on Instagram Live. Yeah, so that is the technique I use. I love it. I think when Hunstead, who just recently retired and contributed so much to the practice of plastic surgery, when he first started doing it, he was wary about doing liposuction to the entire arm, and he just lipoed the area of excision. But now he was lipoing circumferentially, which is what I do.
Yeah, I do that if needed too, and it makes such a big difference. Just doing all the way around the bicep. It's not an area that holds a lot of fat, but in some people it does. And that just gives a nice slim outline.
Yeah. Yeah. So I do like to go all the way around over the deltoid, kind of sculpt back here, and then really get the area that's going to rise, obviously. But then it kind of smooths the whole contour out. Although your arm looks like a giant sausage, you know, immediately post-op. But
yeah, they do swell really quickly.
Right. And so that's one of the things surgically when you're doing this, and you make those incisions and you take that tissue out, you cannot mess around. You need to
No, you have to tap it close.
like secure it and then close, because if you let it sit there and lipoed something else or did something else, it's quite possible that you wouldn't be able to close that incision, which would be dreadful. So
Yes.
I think it's a lot of it. Out of all the surgeries I do, it's a lot of measure twice,
Cut once and do it quickly.
Mm-hmm.
Yeah, it's such a satisfying procedure, though. I mean, it makes an enormous difference.
Yes. And I would say I have patients, I had traditionally thought of it as a surgery for massive weight loss patients, people who lost 100 pounds or more. But lately, I mean, I think it just depends on your genetics. And some people who lose 30 pounds are then like, listen, I work out, I'm fit, and now I just have this loose hanging skin here. And liposuction is I have somebody coming up who had liposuction years ago, and now she's like, I know more liposuction is not going to be the answer because I legitimately have loose skin.
Yeah.
So then so what's the downside? The incision, right?
The downside, of course, yep, it's a long scar, and that's just not an area that scars great. The proximal half, like up toward your axilla, your armpit, that scars pretty well. But when you get that distal toward the elbow, it's red, it's raised, it's wide, and it, like, even if you laser it, even with good scar care, even with good closure. So you've got to be willing to do that trade-off. And for a lot of people, if you have extra skin there, it hangs, it's hard to fit in clothes, you wave goodbye and it continues to wave. And a lot of people are very happy to have that scar because it hides fairly well unless you're like literally raising your arm like this.
Right. And that was interesting at our Atlanta meeting. There was a panel on markings for body contouring. Did you see that?
Yeah, I haven't watched the panel yet. Actually, my friend Sumesh was on it. He was my junior resident. Now he's an attending where I trained. Yeah, he's a good doc.
That's cool. So they talked a little bit about brachioplasty, and they were, most people do what I think we do, which is to try and put it kind of in the biceps crease or a little bit posterior.
Yeah, a little bit posterior, because you don't want it to show either, like on the back of the arm when your arm's down at your side.
Right. So when your hands are to get kind of like this conversation, especially me, because I'm always like doing this, then it's hidden when your arms are like kind of next to your body, and you can't see it from either the front or the back. But interestingly, one of the other presenters does a direct excision straight on the back end of the arm. Yeah.
Whoa.
And he argues that he can get more tissue that way. And I was like, okay.
How are the scars? Did he share any pictures?
He did. I mean, they looked okay. The scars look fine, but they're visible. 100%.
Yeah.
Like, there's no way to hide. So I just thought it was interesting. I was like, okay, not changing my technique, but
no. And the other thing I like about having it, halfway between the biceps groove and the back of the arm is if they've got extra skin and you need to extend below the elbow, you're not over the extensor surface of the elbow.
Right. You're right. And a lot of people do, where they come back and they're like, what about right here?
Yeah, you do have to chase it down. Or even, I think it's Deborah White's technique with the extended, where you get like right here if there's extra skin.
Yep.
I love that.
Did one that comes down all the way around the
like into the inframammary crease.
Someone walking behind me, but it's
oh no, it's my husband. He's doing laundry, which is awesome.
That's amazing. My husband likes to do laundry, actually. He probably wouldn't want me to admit that on IG Live. He always like pulls it out and is like, who's helping with folding? And no one.
No. There's a lot of laundry.
No one's gonna come running to do that. So either fold it or just leave it. I don't know.
Our nanny folds all our laundry. Thank God.
Yeah. Anyway, so and then we have housekeepers that come in and we'll do laundry when they're here and put it away, and then nobody can find their stuff.
Oh yeah, because it's all in different places.
Yeah, you're like,
yeah, I know, and you're like, but I don't know where that is.
Yeah. My kids are like, I don't know where my skirt is. I don't know where Gabby's skirt is. I'm like, I don't know. Ask Martina. I don't know where it is.
There you go.
Look around. Okay. They're also not very good at finding things that are hanging right in front of their face sometimes.
Yeah, one of my favorite phrases that I learned from my nanny is look with your eyes and not with your mouth. Because they're like, I can't find it. But you're not looking.
Oh, that's good. I like that.
Yeah.
What do I win when I find it? Because
You
I
get a
usually
free
do.
skirt or shirt or your
Yeah.
shoes.
What do I get? Is there
Yeah.
$5 in this for me? Because I'll 100% find it for you.
Yeah, absolutely.
All right, cool. So we digressed again, but
We're very good.
I know. So brachioplasty. So yes, I do like that it can extend down along the chest wall and around the curve of the breast. It's very nice for getting all that lateral breast tissue.
Mm-hmm.
It gives you a little bit of an upper back lift too at the same time.
Yeah.
Good for that. And then what else? Do you have any other adjuncts for brachioplasty? I just sometimes, if they're on do you ever do mini brachioplasties, I guess?
I just, people always want them because the scar's hidden, but there are about 2 people I've ever seen who have just extra skin right up near the armpit where it would actually help. It just,
Right?
most of the time, you need a longer scar. You're not going to address all the laxity.
Yeah. I always say mini scar usually gives you results, but there are a few people who it works for.
Yeah. They just have very, very specific anatomy.
I know. So another specific anatomy thing is when you're doing a brachioplasty, and sometimes people will have a weird band kind of in their arm, and you just have to point that out preoperatively because just how you are, and there's no way to really. It's just going to be.
Yeah, and you can, and it's funny, like it's something that, my toddler has those, and I've got a couple like in my forearms where I used to have them and they've kind of smoothed out as I age. But yeah, you can almost leave like a little extra skin there and try to let it settle out, but it's not real reliable, and that's just the way skin tension is. It's not like, wrapping something with plastic and it's perfectly smooth and even.
Correct, yeah, for sure. So those are just like little, I don't know. A lot of times we're all like liposuction in the axilla, like this little area right here. And then so for some patients, liposuction's all they need. And you can get a lot of tightening, especially the lower part of the arm, because I think when you offload, their skin shrinks up a little bit.
Yeah, it does shrink up.
A significant amount. You do like 400, 500 cc's per arm sometimes.
Which is a pound. I mean, that's a fair amount of fat.
Right. And still get a decent amount of arm, like, shrinkage, like almost like a wrap. I also sometimes use Renuvion. I know we've talked about before.
Yeah. But I'm going to move again. We keep needing to do location changes tonight because we have unhappy children who are, like, chasing me. I'm being chased. All right.
I think Sherry's going to depart. She wants to go see what's going on downstairs. Uh-oh.
Why, get away.
It's like kid meltdown.
Oh.
What did I hear this referred to? I heard this called a goat rodeo one time. I forget who said that. It was hilarious. That's kind of what's happening. My kids both want to sit next to me, but then they're like on my lap, and then their hands are in my face, and then they're like waving on camera, and when I move away, they're like chasing me.
Yeah. Well, no, my other dog has now joined us. That's the other one. Sorry. Both ends. Right?
It's okay. We persevere. This is how mom docs do it. My husband is like shutting the door for me. This is real life right here, guys.
That's right. That's right. I know. At least my kids are all stayed downstairs. I just need someone to run in crying, and that'll make the cake.
It's very reasonable.
Yeah, it's just bigger tears, I think.
Yeah, like little kids, little problems, big kids, big problems. Ooh.
Yeah. I mean, we can do 20 minutes if you want to, put out
the screaming's getting loud. I will say, so real quick, we can talk about post-op and recovery. I do compression sleeves, although I find I don't need compression as long as I do after like abdominal lipo. I think just because it's above the level of your heart, the swelling goes down a lot faster.
Yeah, I feel like also the compression sleeves are awful. Like,
they're super uncomfortable, yeah. And they like have this built-in bra that just smashes you flat and is really like high cut and shows under clothing. Yeah, so I'm more inclined to let people stop wearing those a little bit sooner.
Yeah, I put people in A straps, and then the next day or so I transition them to the compression thing, and I just tell them it's the most ill-fitting bolero you'll ever wear, because we've even tried the ones that just are under here.
Yeah,
the boobs hang out of it, and
I know. Or there's one where they're up here and it just like swishes them down and shows in every shirt you wear.
You know, there is no good garment.
No, but
and then I've had
unfortunately, in the back, yeah. So it's like either they don't fasten in the back and you're like dislocating somebody's shoulder to like get their arm in it like this. Because I actually put the sleeves on in surgery, so people are still asleep. By the way, if you ever need help dressing somebody who's unconscious, like get a plastic surgeon. We're really skilled at it. But yeah, you're like dislocating their shoulder to get it behind them, or the ones that hook and back, they're like never lined up right, and then you can't get them hooked.
Yeah,
it's fun.
They're all crazy. Yeah, and then they chafe right here. Like people hate them.
Oh yeah.
And when I do lipo here, there is no great compression garment for that.
No, there isn't. I mean, there's
a roll of socks, like a sock roll under there for as long as you can. You know, if you bra, but it's not. So.
Can you hear the screaming? Does it sound like somebody's dying? I don't think my neighbors have ever called the police.
Little kids were not harmed in the taping of this.
I promise she is okay. She's just very angry.
Oh my God. Well, my older daughter melted down yesterday when the car didn't start. It was with a nanny, and they called me straight up out of work to share that joy with me.
I know, you're like, what am I going to do? I'm at work. I don't know. I know. I can't wait until my kids start making phone calls. That's going to be awesome.
Oh, yeah. Call and text me all day long. It's amazing.
My parents used to pay us to not call them at work. Like, my brother and I would fight, and we would call my dad. He's like, look, every day you don't call us, I'll give you each $1. It totally worked. I mean, this was the 80s. $1 was a lot, but it totally worked. So they just, like, paid us $5 a week to leave them alone. I won't say that like we stopped fighting, but we sure figured it out on our own.
Worked it out, like maybe on your.
I mean, there was generally no blood drawn. The house was still, you know, mostly. The fun part is now I've got to get her up to bed without waking the 2-year-old up. This is why moms have like mad ninja problem-solving skills.
That's right. I would say this is when drinks.
Yes.
That is fun. Erin's saying that she likes all my arm movements. I know
they are pretty fabulous.
I would be the worst person for brachioplasty. You're getting photobombed.
I know. It happens every time.
Because I use my arms way too much to speak. So there would be no hiding the scars.
It's okay.
Around, but it's fine. I'm okay with that.
Absolutely.
Anyway, well, we should. Nobody has any questions on our IG Live, I guess.
You need to stop.
Comment.
Oh, fine.
And
then you're like, I will not yell at them on camera. I won't be that. I'm like quietly whispering death threats.
Yes. But yeah, we should pick a topic for next time.
Yeah, absolutely. I mean, we haven't talked about thigh lift. We could round out the extremities discussions. That's a good one.
Okay. Yeah, it sounds good. We can work on that. Yeah. All right. See you soon.
Enjoy your foster puppy, and we're heading to bed here soon.
Good luck with that.
Thanks. Bye.
Bye.